It feels like homecoming. Minister, leaders of the foundation and the hospital, valued, very valued donors in this room. And I also want to acknowledge the individual who probably taught me everything that I needed to know when it came to running a hospital, and that's Lloyd Barber. I haven't seen Lloyd for a long, long time. I look around this room and I have a lot of mentors here. Harvey is here, Dwight is here, Dick Chin is here, and others that I haven't met. And it's really, really great to spend some time with you. Throughout my entire career, I have always cherished the great work that people like you do through foundations. In fact, it was about 25 years ago that I was pleased to play a part in establishing Saskatchewan's first hospital foundation. So it's really of special significance to me today that I can join you here for a short while to celebrate with you. In my years in healthcare, and I wish the minister was here for my next comment, in the many, many years that I have spent in healthcare, I have yet to find a government that has the fiscal capacity or the deep pockets to satisfy the never, ever ending needs of a progressive teaching hospital enterprise like you have here in this city. So that is why foundations such as yours is the lifeblood. It's the lifeblood of healthcare innovation, it's the lifeblood of research, and it's the lifeblood of delivering exceptional care to the people that you serve. Regina and Region they badly need a robust foundation that can help to advance the progressive healthcare that people in the southern part of the province deserve. And it's obvious to me, and it's very obvious to you, of course, that over the last 25 years, the foundation, your foundation, has had tremendous success in mobilizing those valuable resources and talents and support in your broader community. The $90 million that Judy mentioned to you, that's not just a figure. To me, it translates into $90 million worth of extra caring to those thousands of patients who have benefited from that kind of generosity. By thinking big, by planning boldly, and fostering strong relationship with your donors and many partners in the community, you do continue to make a huge difference in the lives of patients and the work that is being done on a daily basis by the various healthcare professionals. But more opportunities are going to be in front of you. And I hope to throw out a challenge here today, as best as I can, for you to be ready for the Patient First report and the opportunities for positive change that it may present to you. This foundation, this healthcare region, has the potential to make a significant difference in the lives of tomorrow's patients. Let me just try to explain that a bit. In any given year, last year, 3 years ago, the equivalent of 1/3 of Saskatchewan's population interacts with and experiences some form of healthcare offered within the Regina QuAppelle Health Region, the equivalent of 1/3 of all provincial citizens. So if even 20% of those patients voice dissatisfaction about their journey, that means that we have disappointed thousands of patients and their families. Over the past 4 months, we have held a series of patient focus groups in every corner of this province. This is certainly has allowed me the unique opportunity to re-engage with Saskatchewan healthcare and to see how it is offered through the eyes and through the voices of the patients who depend on the system. They have spoken. They have spoken in a forthright, in a very candid way. For the most part, and I want to emphasize this, they give the system in this province a good rating. Many enjoy a strong relationship with their family practitioners, and many are forever grateful to those professionals who go that extra mile to provide compassionate care. The majority of Saskatchewan people are fiercely proud of Medicare for good reason. I don't know which comes first, pride for Rough Riders or pride for Medicare. I guess it all depends if Rough Riders are winning. However, and this is where the but comes in, however, at the same time, many have strongly suggested that much in the system can be improved, or in their words, fixed. Medicare needs a makeover, they have said to us over and over, in very typical Saskatchewan straight talk. In the same breath, they wonder when all of the previous studies that have been carried out will ever translate into meaningful, viable improvements. I think you're all aware. You're all aware of the fact that there's been a tremendous effort, a lot of energy, huge amounts of Canadian taxpayers' money that has been consumed in that quest to try to save Medicare across Canada and find solutions to such things as wait lists, recruitment and retention, and other shortcomings that are troubling the healthcare system. No province that I know, no province has found instant, easy solutions and answers. So let me fast forward for a few moments to a decision made by your Minister of Health and your government to commission a very different review that was launched in January of this year. Your government, with the leadership of the minister that spoke to you, has taken a fresh approach, I guess I would say, by not beginning with the policymakers, the ministry, the stakeholders, the healthcare providers, but rather the starting point with this review is having direct conversations with the patient who relies on the healthcare system. The essence of that review research has been to bring patient stories to the forefront, hearing directly from not only the patients, but their families and advocates whose lives have been touched in so many ways by their need for health care. Many of the experiences that they have shared were very troubling to me, and I am sure that they would be troubling to you. They're troubling to me because I too have been, in the past, part of the Saskatchewan healthcare system. So I take responsibility, some responsibility for some of the past. Generally, I have found and continue to find Saskatchewan people are very, very accepting and have reasonable expectations of the system. That is to say, they, at the end of the day, want quality and safe care delivered within a reasonable time frame by healthcare providers who are kind, who are compassionate, who are respectful, and who are caring. In other words, patients in this province simply want to be treated like people. They ask that the healthcare professionals communicate with them, accept and respect cultural beliefs, keep them informed, allow participation in treatment choices, offer kindness, and above all, what really stands out, they want those professionals to extend a helping hand at the right time.